Good afternoon, press and public. I'm so pleased to be joined today by my esteemed colleagues representing the major healthcare entities in the county of Santa Cruz. These folks have worked beside me tirelessly for the last 18 months as we've worked to address the COVID-19 emergency in our county, in our communities. And I'm so happy to have them here with me in person instead of on Zoom. You'll notice that most or all of us are unmasked, and that's because we're outdoors and we're all fully vaccinated. Anyone who feels more comfortable remaining masked should remain masked. And those of you media folks who are here, it's required for you to be masked if you're unvaccinated because this is a crowded space. So if you're unvaccinated, please do mask. If you're vaccinated, a mask is recommended but optional for you at this time. That's one of the benefits of being vaccinated, is that masks are not required for you in all settings. So we want to drive home the importance today of everyone eligible in our community to get vaccinated for COVID-19. The time has never been more urgent. If you are vaccinated and others around you are not, please urge them to be vaccinated against COVID-19. If you're partially vaccinated and hesitant about that second shot, please do your part to be fully vaccinated. The news here is that the pandemic is not over, and I hope that that's not news for anybody. I've been clear about that from the beginning, as I've wished you a healthy and happy summer, that we are expecting more disease in the fall. I was hoping that we wouldn't be impacted this early in the summer, but we are seeing rising case rates and rising positivity rates in our own community here. Statewide, last night we heard from our local health leaders, our state health leaders, that it's estimated that 80% of our state's COVID cases are now the Delta variant. As you've been hearing, the Delta variant is far more transmissible than the other variants, and it's very rapidly overtaking all other variants that we've had in the state of California. Here locally, we have 11 documented cases of the Delta variant, but we have very few cases here in Santa Cruz County, and very few of those are being sequenced. But we must assume that we, like most of California, have the Delta variant present in a majority of our cases. The Delta variant is more transmissible. It does not appear to be more lethal. However, we are seeing, as our national leaders have alluded to, two pandemics now. Really, it's one pandemic, and that's a pandemic of the unvaccinated. The state leadership last night told us we have a case rate of about 10 per 10,000 people on average. That's a purple tier rate. That's for unvaccinated folks, whereas the vaccinated folks have a case rate of around 2. So that's a yellow tier. So if you think back to those colored tiers, the vaccinated folks are in yellow and the unvaccinated in purple. We are also beginning to see rising hospitalization rates here, and I hope that my colleagues will tell you about some of that in their hospital systems. But we are seeing more hospitalizations here. Everyone who's currently hospitalized in our county is unvaccinated, as we would expect. I'll let my colleagues tell you more about stories from their boots on the ground experiences, but my message to you today, to everyone in the public, is now is the time to be vaccinated if you're not already so. Now is the time to be fully vaccinated. And there are many opportunities. The vaccines are free, widely available throughout our county. Many places you can just walk in and get your vaccine without an appointment. And in many places you can choose your vaccine. So please visit our website at santacruzhealth.org for details about when and where you can walk into a vaccine clinic or make an appointment. I urge you also to consider talking with your primary care provider, your religious leader, or other trusted source of information as you make your decision to get vaccinated. I hope you will do that. And now I'd like to introduce the next speaker in our lineup, and that's Dr. Nan Mickiewicz, President, CEO of Dominican Hospital and trusted partner during this pandemic.
Thank you, Gail, for your comments. We have come so far since the beginning of the pandemic. And before the vaccines were available, all of us here today were at risk of becoming ill. And so it was a frightening time, and our team at Dominican Hospital, along with our partners in the community, came together to meet the demands of caring for the sickest patients in our community. And the light at the end of the tunnel came in December. When the vaccines first arrived in Santa Cruz, we partnered with our county health officer and all of her team, and every one of us essentially sprinted to get the vaccines out to as many patients as we could, and as many community members. With the hard work of our amazing staff at Dominican and our dedicated volunteers, our own hospital was able to do over 33,000 vaccinations. In our experience so far, the vaccine is safe and it is effective. And we're going to keep vaccinating as long as the community needs it. As Gail mentioned, or Dr. Newel mentioned, we are providing vaccinations at Dominican Hospital, and we are offering a choice. So when you arrive, you can choose between the Johnson & Johnson, the Pfizer, or the Moderna. And we are accommodating everyone without charge, because this is too important to us and to the community to not make sure that everyone can have what they need and which one they want. We will be having vaccination efforts expand as soon as the 12 and under are approved, because we feel strongly that anyone who's eligible for a vaccine should have access, it should be free, and it should be readily available. I just want to reiterate what Dr. Newel said. It's not too late to protect yourself and the people that you care about. In the last few weeks, we have seen an uptick of patients in Dominican Hospital, and as she mentioned, they are unvaccinated. And by the time they get admitted, it's too late for us to administer them the vaccine to really impact their outcome. And so I cannot urge you strongly enough to take away that worry of getting super sick from the virus. Take away that worry about causing a loved one, a child who is not eligible for the vaccine, your neighbor, your friends, the people that you interact with out in the community. Take away that worry by getting vaccinated as soon as possible. This is the proper time, if you haven't done it, to protect yourself and everyone that you care about. And depending on which vaccine that you choose, you could be protected against COVID-19 within 2 weeks and up to 6 weeks. So I want to just really reinforce that for everyone. I want you to know that Dominican Hospital is here to continue to participate and support the county's efforts. I want to congratulate Dr. Newel and her team on an excellent job of taking care of Santa Cruz County. We could not have been in better hands as we have been with Dr. Newel's leadership. So I thank you for your time, and let us know how we can help you as we go forward to prevent further illness in this community. And it's my pleasure to introduce Stephen, I want to make sure I get it right. Stephen Sayler, Chief Executive Officer at Watsonville Community Hospital.
Thank you. So I'm Stephen Salyer, the CEO of Watsonville Community Hospital. I just want to take a quick second and really just advocate for the employees, the physicians at our hospital. There's no doubt they're tired, right? And it's not just my hospital, it's every hospital across the nation. The nurses are tired, right? The doctors are tired. This pandemic has been extremely stressful. And really what I'm asking is we need support from the community to help our frontline workers. I want you to please hear that message. We absolutely need your help. There's already a national shortage of nursing staff across this nation. There's already a shortage of providers, and certainly this pandemic has weighed on everyone. We've seen nursing staff, techs, frontline workers in the hospital actually leave their profession because of this pandemic, and has actually added to the strain within the health system. So once again, I'm just urging you, please, as I round with my staff, I round with providers, as I talk to other leaders within the community, it is absolutely urgent that everyone within our community take this serious, help the frontline workers. They were there for all of us during this pandemic. We need them to be available as we continue through this pandemic, and it's not over. So please do your part. And once again, thank you, Watsonville Community Hospital, nursing staff, techs, physicians, dietary staff, everyone across the board. I'm just gonna say it, I love you guys. Thank you very much. It's honorable to be your CEO. And once again, community, please do your part. Thank you. And I'm gonna introduce Dr. Martin with Sutter. Thank you.
Thank you very much. I'm Dr. Catherine Martin. I'm a family medicine physician with Sutter Palo Alto Medical Foundation in Watsonville. As you've heard already, new cases of coronavirus are rising in Santa Cruz County, and the vast majority of infections are among unvaccinated persons. COVID-19 still remains a very real threat, but one that we can now protect ourselves from. I am here today to urge anyone who is eligible and who has not yet received a COVID-19 vaccine to get one. I would like to especially encourage young adults, that is people under the age of 30, to receive the vaccine. Young adults have the lowest rate of vaccination and represent a critical gap in our pursuit of herd immunity. As a physician, I can tell you that being young and otherwise healthy doesn't guarantee natural immunity against COVID-19. Young people who contract the virus can still develop debilitating short and long-term symptoms, and while rare, there have been young people who have died from COVID-19, including those who were completely healthy beforehand. Additionally, I would urge all young adults to think beyond the risk that COVID-19 presents to you personally and start thinking about the risk that remaining unvaccinated presents to the community in which you live. Young adults are more likely to socialize in groups, go to bars, restaurants, and work and live or attend school in high exposure settings. This increases their risk of contracting coronavirus and spreading it to others. Not only does this keep the virus circulating and mutating, it also puts the people that you encounter at increased risk. This includes those who aren't able to be vaccinated because they are too young or in whom the vaccine is contraindicated. Even if you never develop symptoms from COVID-19, you can still pass it to others, and studies have shown that young adults are a major source of transmission. Nearly 60% of eligible Santa Cruz County residents are vaccinated today, but our work is not over, and the pandemic is not over either. We need to focus on closing the gap and vaccinating the remaining 40% of the population as soon as possible. The longer we wait, the more time the virus has to mutate and place our community at risk of being infected by a new strain that cannot be controlled with our current vaccines. Thank you. I'm now going to introduce Dr. Cristina Gamboa. She's Director of Women's Health for Salud Para La Gente.
Good afternoon, everyone. It is a pleasure to be here. Again, my name is Dr. Cristina Gamboa. I am a physician at Salud Para La Gente and also the Director of Women's Health at Salud Para La Gente located in Watsonville. I'm here with my colleagues today to remind all of you that the COVID pandemic is not over. We are happy that so many in our community have been vaccinated, and we'd really like to see more of our patients get vaccinated against COVID-19. The more people in our community that are vaccinated, the greater protection that we'll have as a whole. I'm an obstetrician. I know those planning to become pregnant, those who are currently pregnant, or those who have recently delivered may have concerns about receiving the COVID vaccination, and that putting anything in their body may put themselves or their baby at risk. I'm here as an obstetrician and as a professional to reassure you that the COVID vaccination has been shown to be safe in pregnancy and has actually been shown to be beneficial to baby when done in the breastfeeding period. I encourage all moms during their prenatal visits that if questions come up about the vaccination or that they are desiring to wait, that an active plan is made so that vaccination can be done as soon as delivery happens. I want to also continue to see that loved ones around women who are pregnant continue to get vaccinated to help protect those and protect them and their family. The Delta variant is on the rise. I am concerned about the impact this can have to those who are unvaccinated, especially on those pregnant women in our community. The Delta variant is more transmissible, which means that it's easier to catch. The best way to protect yourself, your family, and your community is to be vaccinated. If you haven't received the COVID vaccine already, I sincerely, from my heart, ask that all of you seek out where vaccination can be done and to do that as soon as possible. With our increase in COVID cases that we're seeing, almost all the new cases detected are in those that are unvaccinated, as my colleagues have already shared. Please also remember that when initiating your vaccination process, if you have chosen the 2-dose process, that you adhere to getting the second dose. It's very important that you have both doses to be fully vaccinated. The COVID-19 greatly impacted Watsonville and essential workers in our community. I saw firsthand how difficult this was for the Watsonville community and the Latinx population in Santa Cruz and in our county as a whole. As we open more businesses, I want to assure that our community is protected and that we don't experience the same surge that we had last winter and the experience that we had last year. The COVID vaccine is the primary tool that will help us avoid a surge like we experienced last winter. In addition, as children prepare to go back to school, we are seeing an increase in cases. It is more important than ever that children ages 12 and older get vaccinated to protect those and those around them as they return to school. By being vaccinated, you're not only caring for yourselves, you're caring for your family and you're caring for your community. I encourage you that if you still have questions about the safety of the vaccination, how to get it, or what the potential side effects may be, that you talk to a skilled medical provider or a trusted source in your community to get the correct information. I appreciate all of your guys' time and the community's participation with all the efforts that have been done, particularly as it relates to vulnerable communities, the Latinx community, and just continue to have everyone in the community partner together so that we can make progress coming into the next year. También voy a hablar un poco en español por esta comunidad. Buenas tardes, mi nombre es doctora Cristina Gamboa. Soy médica y directora de Salud Para La Gente de Mujer en Salud Para La Gente. Hoy estoy aquí para mis colegas para recordarlos a todos que la pandemia de COVID-19 no ha terminado. Estamos contentos que tantos en nuestra comunidad hayan sido vacunados y nos gustaría ver a más personas recibir la vacuna. Cuantas más personas se vacunen, mayor será la protección en nuestra comunidad. El variante Delta es muy aumento. Me preocupa que el impacto que esto puede tener en personas que no están vacunadas, especialmente en las mujeres que están embarazadas. El variante Delta es más transmisible. La mejor manera para protegerse es para recibir la vacuna. El COVID-19 impactó en gran medida de la comunidad latina y en Watsonville, y también los trabajadores esenciales. No queremos ver una nueva ola de COVID-19 como los vimos en el invierno. Podemos prevenirlo si todos ponen de tu parte y se vacuna. Recuerda que si cuida a tu familia y tu comunidad. Gracias. And with that, I'd like to turn over to my colleague, Dr. Magarian from Santa Cruz Community Health Center. Thank you.
That's it. Thank you. Good afternoon. My name is Salem Magarian. I'm a pediatrician, and I'd like to direct some very brief comments to parents, grandparents, and friends of children. And I pretty much think that covers all of us, because we're all very much interested in the health of children and how this community does during this incredibly stressful time. So I've been a pediatrician for 41 years. I've been here in Santa Cruz for the last 30 years and seen enormous changes. And my reflection on immunization practices is it's been one of steady, dramatic improvement. The immunizations we routinely give to children are safer, more effective, and many of the diseases I used to worry about every day as a practitioner in the early 80s are pretty much gone. Bacterial meningitis has completely decreased. Hepatitis A and B have been knocked on their knees. Cervical cancer is being decreased. There's been some remarkable gains all around, but those are nothing compared to what we have to offer for COVID-19. The science behind it is remarkable. It's breakthrough technology. A lot of it has been done right here in California universities, but it is truly awesome and breathtaking what happened. The regulatory process for immunization is built in for safety. And that's part of the reason that these immunizations have not received official approval, although they probably will at any time. It's because the process of approval is so detailed and so careful. But as remarkable as it is, there's been a huge natural experiment that gives almost more information than we've ever had about an immunization in terms of how safe this shot is, how dramatically effective these immunizations are. And in our situation now, particularly with the mRNA vaccines, the incredible efficacy even against the Delta variant. There's another natural experiment that I've never seen in my career that's happening right now before us. And I'm not sure how that history is going to be written, but now on the heels of seeing how effective that vaccine is, we're seeing an experiment of the impact on people who have chosen not to have that vaccine on themselves, on their families, and on their communities. And I'm not making any judgment on that. I'm saying that's just science, having an opportunity to see firsthand what happens in two populations, and the results could not be more dramatic. Which leads to another thing that I've just been thinking. After all this, I think the scientists have been amazing in this process. Policymakers, even policymakers that I don't agree with, have been amazing on this. And now, it all depends on the people who have not chosen to get a vaccine. It's really in your hands to turn this around. And you can very easily. You'll protect yourself, your family, your children, community, the economy. So I hope you choose to get the immunization. Thank you very much. Oh, and I get the honor of presenting the president of the Santa Cruz Medical Society. She is an internist at Kaiser Permanente. Her name is Joyce Orndorff. No, Orndorff.
I'm supposed to speak after that? Oh my goodness. Thank you. Thank you, all of you, for being here, for your work. Can we all agree that it's been a really rough year plus? Yeah. Can we all agree that we want to get out of it? Yeah. So I had some prepared remarks, but after hearing my wonderful colleagues, I am not really certain what to say that wouldn't just be reiterating. I'll just say a few things. My name is Dr. Joyce Orndorff. Thank you very much for that excellent introduction. I am a Kaiser Permanente internist. I am also the current president of the Santa Cruz County Medical Society. And me as an internist, me as Kaiser Permanente, and me as the Medical Society, I have a lot of hats. I'm proud. we're proud to just stand alongside here with our friends in the Santa Cruz County healthcare community together to urge you all, if you haven't thought about it already, to get the vaccination, to please consider doing so. Our numbers at Kaiser Permanente match what you guys have seen. We're seeing a surge. We're seeing an increase in hospitalizations, an increase in positive cases, that especially after the July 4th holiday, and this tracks right in line with the surges that we have seen over the last few major holidays as well. It's a pattern. It happens. And because that Delta variant strain is more easily transmitted, it's so much more important now to close any gaps that may be there, to protect ourselves, to protect all of us. You've heard it from my colleagues. You guys are amazing. The information, the research, everything supports the continued protective effects of the COVID-19 vaccination on disease protection, disease course, and disease transmissibility. And you have heard that it's those that are unvaccinated that are at the highest risk of contracting the COVID-19 disease. Vaccines are effective. You've heard that as well. They are absolutely effective at preventing illness, at preventing transmission, including the Delta variant. This just remains our absolute best method to continue to further prevent the spread of disease. So, if you haven't thought so already, if you haven't considered already, please consider getting the vaccination. We have your vaccination. You've heard. We have your vaccination. We are ready for you. Please come get your vaccination to protect you, to protect your families, and to protect our community. Thank you.
Thank you. We're going to do a quick Q&A. Let me see if I can level up my microphone real quick first. I'll just call on people from over here. Just going. All right. Adriana, go ahead.
What is the protection with just one doses of the vaccine? 40%, people are saying one dose will be okay, but it's not okay. What is the protection with just one dose?
A general statement is that all three vaccines remain highly effective in protecting folks who are fully vaccinated against serious disease, hospitalization, and death. We are, with the Delta variant, seeing a few more cases, breakthrough cases, or cases among the vaccinated, the fully vaccinated, regardless of which vaccine. All three vaccines are showing some, but the disease is mild in vaccinated people, maybe even not symptomatic at all. And one difference to note is that the Delta variant has more of the upper respiratory symptoms, like sniffles and sore throats. So even if you think you might just have a cold or an bad allergy season, please stay home if you're having any kind of symptoms of illness until you have a negative COVID test result or are feeling completely well. But depending on the study, depending on the vaccine, depending on the population in which it's tested on, there may be different reports of infections in vaccinated people, fully vaccinated people, but it still remains very low. In the state of California, currently, about 2% of infections are in fully vaccinated people.
Adriana, were you asking about what the effectiveness of one dose is?
Yeah.
Yeah.
People that
Oh,
Moderna
I'm
and Pfizer
sorry.
said that just with a shot, it's okay. But Johnson is okay. But only one shot of Moderna, Pfizer, doesn't make, right?
Right, so only one shot of Pfizer or Moderna, the two-dose vaccines, make the vaccination much less effective, perhaps only 33% effective in one study, maybe a little bit higher, but it's very important to get that second dose.
So we're going to go to Todd and then Steve. Todd, go ahead.
I was wondering if one of you could say something about how many people have been vaccinated versus how many people still need to be vaccinated in Santa Cruz County? You keep those numbers?
The numbers of
Yeah.
vaccinated versus
Fully vaccinated versus.
So in the, I think in the eligible population, it's in the upper 60s for fully vaccinated, but it's only, do you know the number for the?
Go to the podium.
All right. Yeah, I haven't checked today, but in the eligible population, the number of people that are fully vaccinated, it's in the 65, 68 range. I can get those numbers for you, Todd. As a percentage of the entire population, which includes children under 12, it's I think it's in about 60. Is it a little lower? Yeah. I'll get it to you, Todd.
Okay, thank you.
Go ahead, Stephen.
I have two questions. The first one is, you expressed concern over folks under 30 who haven't been vaccinated. You get a lot of visitors. We're 3 weeks out from 4th of July. How has that impacted this surge? Did you expect it to impact that much? What are your thoughts on that?
We expected to see an increase in cases as California opened and as the nation opened. June 15, I believe, was the California opening date, and 4th of July, as you know, our president declared that we would have a somewhat normal 4th of July. So the message was clear to our public. So we expected to see an increase in cases. Santa Cruz County, as you alluded to, is a hotspot for tourists, and many of those tourists are coming from areas of California or parts of the world or the nation that are less vaccinated. That does put our own community at greater risk, especially those who remain unvaccinated. So that's just one more reason to get vaccinated, is if you haven't already, is to remember that it's not just our own community members with whom you're interacting, it's also visitors to our community.
I have another question, if I may. There's also a concern in the Latinx community, and you have a lot of, it's getting close to harvest time. You're going to have a lot of people coming in from other areas. Can you talk about that, the importance, or that aspect of this?
Yeah, thank you for your question about our particular vulnerable community, speaking to the ag workers. You know, we in Salud Para La Gente in Watsonville have really emphasized partnerships with local ag communities so that and companies, so that they are able to educate their employers as they're coming and offer vaccination and partner with Salud and in our local community to receive it. That is, kind of where our efforts are made when we live in a large ag community, is really working with the stakeholders who have high contact with ag workers, and also working with their family members. Often when people are coming to work and return for seasons, they have contacts and families in the community. And so having their local family members vaccinated and the education will really then seed out to those who are recently arriving to work and do great service for our country.
I have one more question, I'm sorry. Do you see a lot of hesitancy in that community for people to get vaccinated?
I think
Seen it in other areas.
I think we see hesitancy in general, and it's really hard. There's not a study to show that Latinx community is more hesitant than any other community, but I think what we know from just general health practices is that those more marginalized communities and those more vulnerable will have different rates of disease and different access to services. And so I think education and availability of services and addressing our inequities that have been in our healthcare system for a long time are extremely important to balance out what the rates are in different communities of color. And what I can say as a bilingual, bicultural provider myself in Watsonville is that the Latinx community has a lot of trust in the medical community, and it really does require us as medical professionals to use that trust, use those relationships to have honest conversations with people. If you're not familiar with the U.S. healthcare system, you may not have the same trust as someone who is born here. And so really dispelling myths and creating good relationships with families and patients is the most important thing we can do as a healthcare community and as a community in general.
I have a question regarding that same topic. Salinas Valley, Monterey County, Salud Para La Clínica Salud Valle de Salinas, and Robert Shipper, they have a joint effort to vaccinate thousands of our workers. Every weekend, they have like thousands of our workers. Are you guys planning to do something like that in the near future?
Yeah, I know there's a lot of efforts that have been made. I unfortunately can't speak to the specific plan of rolling that out in Watsonville area, but I think one thing to keep in mind is that, you know, our communities are kind of a continuum. A lot of people work in Salinas and live in Watsonville, and so those areas and partnerships that are existing are going to benefit all of us, but they are definitely good examples, and I appreciate you mentioning them, because I think just hearing that those things exist are just good topics of conversation to keep the brainstorming and dialogue going of what else we can continue to do.
Maybe a follow-up.
In the County of Santa Cruz, we have been working very closely with our Farm Bureau and our Ag Commissioner from the very beginning of this pandemic. Way back in March of 2020, we were already coordinating efforts for education, for masking, for testing, and now for vaccination. So we believe that the vast majority of our migrant ag workers and our ag worker community in general have been offered vaccination, and most of them have taken advantage of that opportunity. We've been offering vaccination right on the farm sites, working with the farmers through the Farm Bureau. Over 130 different farmers have participated in that process.
Gail, I have a question. Just real quick.
Right here, Phil, sorry.
I'm sorry.
For Stephen and for Dr. Mickiewicz, is it? Mickiewicz. Can both of you speak to the number of hospital employees vaccinated? I mean, is that something that you stay on top of? And also down the line, for those who aren't, could you possibly see it becoming mandatory in order to keep your job?
So I would speak to Dominican Hospital, as that's what I'm most familiar with. So far, we have over 85% of our employees who are eligible, who are vaccinated. We are working with some of the folks who have been on leave of absence, which make up the bulk of our unvaccinated staff, to see if we can get them vaccinated when they come back to work. Our physicians are over 90% vaccinated, those on our medical staff. And it's a little harder to track them because they're not our employees. They have privileges at the hospital. As with all healthcare systems, Common Spirit, Dominican Hospital, we are looking at whether or not this would be a requirement for employment, and we don't have a decision on that at this point in time. But obviously, a discussion.
Will they answer if a patient asks, hey, are you vaccinated?
Most of our staff, I believe, would answer that question proudly. When we started vaccinating in December, we were one of the first vaccination sites, and the response from our employees was overwhelming. Very excited about the chance to protect themselves and the patients that they take care of.
So you're not ruling it out of someone making it mandatory?
As I said, everything's under discussion at this moment in time.
Sure. Very similarly, Watsonville Community Hospital, we're the higher end of the percentages is where we are. I'll get back with you with the exact percentages, but the vast majority of our employees and medical staff are vaccinated. But I'll get back with you the exact percentages. As for, are we making it mandatory? As of right now, we are not. But we'll continue to work with our medical staff, our board, etc., on that determination. But as of right now, it is not mandatory. And I do also want to share that, every patient that comes through our facility, we do offer to provide the vaccine for free, and we are highly supportive of it. Thank you.
Go ahead, Phil.
This is for Dr. Newel. I was just wondering, Los Angeles, they talk about shutting down some restaurants and things like that. Do you think we're headed back into that direction? Businesses might be affected because of what's going on if people don't get vaccinated?
I don't see closures of the economy as part of our future unless things get very dire. And I don't see things getting dire. The vast majority of us are fully vaccinated. More will get fully vaccinated. And so when we do see a surge, it should be smaller, fewer hospitalizations, fewer deaths, less impact on the economy. So I don't think that we'll be seeing any closures of businesses or schools.
I have one more question for you. The hesitancy, what do you think is behind this? I mean, why are people afraid to get the vaccinations? They might have their own reasons, but
are they being influenced by social media? Are they being influenced by national news? What's your take on that?
Initial data on some studies that have been done around vaccine hesitancy or vaccine resistance are that of the 30% or so who are not availing themselves of the vaccine, those who are eligible, about a third of them are absolutely resistant, anti-vaxxers, and probably nothing will change their mind short of requirements. Another third are hesitant, they're slow adopters, they want to be careful in their decision making, many of them waiting for full FDA approval, which is coming shortly, we think in early September, so very soon. And then the last third of that 30% seems to be just not finding the time. So that's who we're really wanting to reach right now, begging you to please think beyond yourself, beyond your immediate pod of friends, and think about your elderly family members, the greater community, and get vaccinated.
Melissa?
Yep. I was wondering if someone could speak to, we talked a lot about how the youth vaccination rates are low, and so what our outreach efforts in the county are, it seems like that's a community-driven effort and not just a county effort. So yeah, if someone would speak to that, that'd be great.
Pediatrician?
I'd rather not comment on that. I'm not involved in it directly.
I can talk to it if you want. So we would be very happy, I think everyone here in partnership, to make the vaccine available to those who are 12 and older who are eligible for the vaccine. We have had some specific clinics for the pediatric population, and we have collaborated with our pediatricians in the outpatient setting so that they can provide it to their patients. I think we just need to continue to be consistent in the messaging about the safety and to encourage people to take advantage of it. We are anticipating that before school starts, hopefully, 3 to 4 weeks before school starts, we will have more people coming forward, and at that point, it would be great if we could collaborate as a whole healthcare system to make sure there is plenty of opportunity, days and evenings and weekends, so that the parents can bring their children in.
Just want to quickly point out on that point, you mentioned young adults. We have a couple colleges in town, and both Cabrillo and UCS are requiring vaccinations as part of a return to campus. So you'll have off-campus options, but if you want to go back to in-person learning, you need to go get vaccinated. I think they both sent out communications to their communities about that. Cabrillo, I think you need to get going pretty much last week in order to be fully vaccinated by the time classes start. You can still take the Johnson, that's 2 weeks out. And then UCSC, I would just encourage everybody that's going to UCSC in the fall to get started now.
I think we have one there.
So I guess my question is, multiple Bay Area counties are asking employers to consider requiring their employees to get vaccinated. Is Santa Cruz County considering doing something like that?
The Bay Area health officers have been in discussion for the last 10 days or so about releasing a statement encouraging employers to up their game to get more of their employees vaccinated. My understanding is just prior to this press conference that Contra Costa, Santa Clara, and San Francisco released information stating that they would be asking their employers to require vaccination for continued employment status. Santa Cruz County is not going in that direction at this time. We hope to join a Bay Area health officer statement with the remaining counties, encouraging employers to up their game by doing things like requiring documentation of vaccination, requiring testing of all unvaccinated employees, and requiring stricter masking guidance for those who are unvaccinated. So we hope that in the coming days there'll be a release from the remaining health officers.
Tom, did you have something?
That was my question.
That was it?
I just wanted to ask, Dr. Gamboa, you mentioned when you were at the podium about pregnancy and the concern that a lot of women have. Can you also, for me, just touch on the concern from men who are looking to start a family? Because I've had that argument with a few young adults.
In terms of them also receiving and how it can affect their fertility.
People in their 20s have talked to men are not wanting the vaccine because they're afraid of how it would affect them when it comes to trying to start a family.
Yeah, well, I think first, their acknowledgement should be given to the preconception planning. I think having those conversations and preparation is really important, but also gaining the correct information that's medically supported is important. And there has not been shown that the vaccination, and I can speak mainly to women, has affected their fertility. I don't unfortunately know of any studies that have specifically looked at male fertility, but I know generally speaking, it has been thought to be safe for male of reproductive age. And so I think just having the correct information is important, and not using that as a reason to not get vaccinated.
Okay, look, my question is about the sequence of the Delta variant, and if all the positive cases that you have, COVID-19 cases, what percentage of those cases are just going through this sequence? And because you said only few cases. And what is the, can you explain on the process about doing these sequences and how difficult it is or not? And also, President Biden is announcing more funds for testing, and if you're gonna get funds from that, and if sequences are going to get more funds or something like that.
So our cases here in Santa Cruz can progress to whole genomic sequencing through several different pathways. One is that the state is randomly selecting 10% of all positive cases to do whole genomic sequencing on. They do send those results back to the local public health department so that we have the information as well and can share that with providers. But it's mostly just to get a sense of what kind of trends are happening in our own communities, a surveillance process. In addition, there's a process for testing specific samples who are high risk. For example, they're hospitalized, or they've had recent international travel, or other things that would put them at risk for a variant of concern. And lastly, our own fabulous genetics lab here at UC Santa Cruz has been a fabulous partner throughout our entire pandemic. And they are doing genomic sequencing on any of the samples that UC Santa Cruz is running on their testing. So those are the three channels through which we're getting genomic sequencing results at this time. It is a very expensive and time-consuming process. It generally takes us 2 weeks to get the results after we submit a sample. So we're always lagging behind on what's actually happening. So we're working with estimates when we say 40% locally, 80% statewide are due to the Delta variant.
Can I in regards to that sequencing, so is it the reason behind it, does it have to be because of the process that it is, why only limited are being sequenced? Is it because of the process and the cost? Is that the reason behind it?
It requires highly skilled personnel, of which there aren't very many, and highly specific laboratories. So we're very fortunate to have UC Santa Cruz here in our own community that's able to do that. And they're also processing for the state as well. So right here in our own backyard, there's heroic work going on in the laboratory front. And it takes time.
Do you think that part of those funds are gonna go only for testing, or you think it's gonna get part of the sequence process?
There are increasing funds coming from the federal and state governments for increasing laboratory testing, and I'm sure that will include whole genomic sequencing as well.
We're gonna have, I know a couple more questions, but I know Adriana's got to get going. Do you want to try to disengage your mic here? There you go. All right, sorry. Is there a couple more? Go ahead.
I know that we discussed fully vaccinated persons are
else want to talk about non-pharmaceutical interventions? All right, so the message around non-pharmaceutical or non-vaccine strategies for reducing risk for COVID remain the same as they have throughout the entire pandemic. I cannot emphasize the importance of staying home if you're feeling sick, even sniffles, sore throat. The Delta variant is showing much more of that kind of presentation. So don't rely on just the deep cough. It's the sniffles and the sore throats now too. So very easy to confuse with a cold or allergy. So please get tested. If you have any symptoms at all, stay home until you feel better and know you don't have COVID. Also, hand washing is important, staying in well-ventilated spaces. So if you're indoors, open windows and doors. It's a great time of year to do that. Get that cross ventilation across your rooms. Don't gather with unvaccinated people indoors. That remains the same. Wear your masks in public spaces. All of us now, I'm recommending that even vaccinated folks in crowded outdoor and indoor public spaces wear your masks. A reminder that masks are absolutely required indoors for in any kind of gatherings for unvaccinated people. And what else? Physical distancing, still important, especially indoors. So especially if you're in a mixed vaccinated, unvaccinated crowd, physical distancing still has its place as well. What have I forgotten?
You did it.
Done. Okay. And I can't emphasize enough how excited we are to get our kids back to school. I know parents especially are feeling that way. So we're still anticipating kids back in the classroom full time coming up in just a few weeks here. We're on track, working hard with the County Office of Ed to ensure that that's possible.
Just wanted to circle back to that hesitancy. You kind of mentioned a little bit social media, the misinformation. How much are you seeing it affect people's resistance to wanting to get the vaccine? And what are you all individually doing in your respective areas to try and get that word out and maybe combat the misinformation and those folks that are relying on social media as their sole source?
Social media has played a huge role in misinformation and spreading of misinformation and disinformation. And that was emphasized by the Surgeon General of the United States last week in his first formal announcement and release of information, calling on the tech giants and other social media efforts to stop the spread of misinformation, which is literally leading to lives lost in this country.
And we're starting to lose people because they've got to go back and see their patients. But do you have one more?
Yeah, I was just going to ask, we talked about the requirement or lack thereof for medical staff to get vaccinated at the two hospitals, but I'm also wondering about Sutter and Kaiser facilities, if you guys can speak to that, whether you know if your staff are required to be vaccinated and approximately like if the majority is. I don't know if you have the exact percentages.
As far as Sutter Health, I don't have the exact numbers. I know personally in my clinic, the majority of our staff and providers are in fact vaccinated. That's really all I can speak to.
And I'm sorry, Melissa, but Kaiser just.
Yeah.
They've departed.
Can I ask one last thing, Chris?
Let's go. We'll have two more of these two.
So, I think once again it was Dr. Joyce who mentioned it. You said that when people come in, they can request any of the 3 vaccines. Early on, I know public health officials really discouraged that. They really did not want people to be able to say, this is what I want. Obviously, or I'd like you to say, I'm sure it has something to do with supply and timing.
Correct. In the beginning, we did not have the numbers of vaccines available to us to provide to people. And so we were doing one type of vaccine per clinic and focusing on that. But now that we are very proficient, all of us, in managing each of the vaccines, and we have an ample supply, it's really all about making sure people get vaccinated. And so we want to make it as easy as possible, and we want to make sure that people have their choice so that there's no reason not to get vaccinated. So it really has everything to do with supply and our level of comfort with each of the vaccines at this point.
So just to follow it up again, so is Santa Cruz expecting to act up their testing centers? And also for parents, this is one of the questions that we receive. When should parents consider testing their children? How often, especially with summer camps at the moment? That's just a big concern for parents from our viewers that we've heard, so we just want to see if we can get that question addressed.
Hi, Dr. Magarian, pediatrician. We get asked that question commonly, and I think right now pretty much any respiratory illness is a valid reason for testing. It usually comes back negative. It's very reassuring. It's very important in your planning, and I think that's very important in group settings. As we move back to school, I think we want to slightly, in any way, over-test and under-test. We don't want to miss anyone that could be spreading this.
Hey, thank you all very much for coming. Appreciate it.